Welcome to another episode of the Bleeding Edge of Digital Health. Really excited about today's guest, Dr. Ashul Govil of Story Health. He's is it co-founder or founder, Ashul?
Co-founder and chief medical officer.
Oh, that's right. Yeah, chief medical officer of a really cool platform that's been built to address heart failure and beyond. We'll get into a little bit of that later. But Dr. Govil, thanks so much for joining me today.
Absolutely. Happy to be here. Thanks for inviting me.
Was looking forward to this one. Before we jump into kind of the platform and what you guys have going on, what I'd like to do is just kind of have you give a brief explanation of heart failure and kind of the challenges associated with it.
Yeah, absolutely. And as you alluded to, heart failure is kind of the first area that we kind of dove into. We've expanded since then, but it's really sort of the core of the product as of now. Heart failure is a big problem, obviously, in this country. It's a problem that's been growing over the years, now 6 to 8 million people with heart failure, and one of the leading causes of hospitalization, rehospitalization, and cost driver for hospitals and payers for Medicare. So it's been a large focus over the last several decades now. And how do we actually reduce costs? How do we improve care for patients? This is kind of one of the big focus areas for a lot of people because of just the impact that it's had. And unfortunately, even though we've been focusing on this problem for probably about 20 years, we still haven't made as much headway as we'd like. And there's still a lot of problems left to tackle.
So yeah, it's definitely, I know the numbers are clear. It's a big issue for hospitals in terms of readmission and whatnot. Can you just give a brief description of the physiology? What happens when heart failure occurs?
Yeah, so they actually redefined what heart failure is very recently, just last year, because I think we're evolving in how we think about heart failure. Heart failure really means that there's some dysfunction of the heart, how it's working, and that's causing basically you to retain fluid that gets in the lungs, causes shortness of breath, causes other symptoms, and downstream causes other effects to other organs, whether it's your kidneys, your liver, etc. And there's many, many, many causes for heart failure because we've really broadened a sort of the spectrum of what we define as dysfunction of the heart, but really any dysfunction that's causing these problems.
And so it's basically constricting the heart's ability to beat properly and to contract and expand.
That's right. Yeah. I mean, fundamentally, the heart, it's basically a big pump, right?
Yep.
It fills with blood that comes from the body, pumps it out to the lungs so that the blood can get oxygen. That blood and oxygen come back to the left side of the heart, and the heart pumps that blood and oxygen to the whole body so the body can use the oxygen in the blood to make energy that it needs and do all the functions that it's supposed to do. When that pump starts to fail and it's not working properly, your body's not getting the oxygen it needs. You don't have the energy you need to not just move around and exercise, but even to just do the normal body functions of your cells.
Yep. Yeah. I've known several people that have been afflicted with it. I actually had a fraternity brother of mine from college who passed away not too long ago from heart failure. And it's a really, to say it's debilitating is an understatement. I mean, in his latter days, he couldn't even get up and go to the bathroom.
Wow.
It was pretty debilitating. But no, that's a good foundation for the rest of the conversation. Can you go into, I think what probably makes the most sense is to just kind of have you give a brief description of the platform. The company is Story Health. You guys have an amazing platform. It's a virtual care platform, if I'm using that term correctly. Tell a little bit about the platform and kind of the use case that you guys saw. What were the gaps in care? Where were patients slipping through the cracks where you thought there's something here? That'd be great for the audience.
Absolutely. Yeah, and maybe it's helpful to kind of back up a little bit and think about like why we started the company in the first place. What was the initial motivation? Because that really kind of helps inform how we developed the platform and why we chose heart failure as a first focus area. For myself and my two co-founders, Tom Stannis, Nikhil Roy, we all come from a healthcare background to some degree. I'm obviously a cardiologist and have been in working with medical devices and health tech for a number of years. Tom and Nikhil both come from Verily. And I think one of the things we've seen over the years is there's this gap between what we know the science of medicine can do and should do and what actually happens with patients in the real world. And unfortunately, medicine has been slow to change. So we're still practicing medicine the same way we were 50, 60 years ago. You still go to your doctor and they do a couple of tests. They tell you to come back in a year, 6 months, 3 months, but they really don't have any sight of you between those visits. It's a big black box that exists, right? And when they do see you, they see you for 10 to 15 minutes. So can they really truly assess all the problems that you have, especially if you have something complex like heart failure. If you just have a cold, maybe that's pretty easy to treat in that 10, 15 minute visit. When you have multiple problems and very complex problems, it's really hard to do, especially when there's no interaction between those visits. I think this was fine 50, 60 years ago, right? We didn't have a lot of testing we could do for patients. We didn't have a lot of therapies. Preventive care wasn't even a thing back then. But now that we have all those things, now that we've had exponential growth and how we can test you, understanding of disease, the therapies we can provide for you, and of course, now we have preventive care. We can prevent the problems from happening in the first place. That model of care hasn't grown to adapt to that. And that's left all these gaps in care. And that's kind of what we saw as a fundamental problem in healthcare today. And no one's really addressing that issue, and at least not in a meaningful way. So, in the last few years, we have seen some digital health companies who try to address these issues, but they're really nibbling at it from the outside. We didn't really see any effort to enable the existing healthcare systems, ones who are really deep into these complex problems with these complex patients. No one really helping enable them with the technology they need to update their sort of care model, going from this traditional care model to more of this continuous hybrid care model. And that's kind of how we thought of the companies. We have these gaps. We think we can bring technology and more of a continuous interaction with the patient to fill these gaps in care. That's what we need to build. And heart failure was the obvious first choice because of how big the problem is, as I stated earlier, but also because there's a lot of really low-hanging fruit out there for heart failure. Yeah. The problems that we could solve with technology, and there's just no excuse not to. That's kind of how the platform idea came about.
If I'm understanding you correctly, under the traditional model, it's kind of like the doctor's only working with that point in time in which they're in front of the patient. Whatever's happening at that moment, that's the only data that they've got to make decisions along that entire continuum of care. And the goal being, obviously, is for that doctor to not know just what's happening when the patient's in their office, but also what's happening when they're at home or when they're exercising or when they're working or whatever, and to be able to aggregate all of that and allow the physician to make insightful decisions about the care moving forward. Is that correct?
Absolutely. And of course, in today's day and age, even if you have the ability to do that, we don't have enough doctors to go around, right? So the pandemic has really created a shortfall in the number of nurses, number of doctors. I was just reading an article the other day, 25% of doctors are looking to leave medicine in the next few years. And we don't have enough new doctors coming in. So how are we going to have enough doctors to treat this vast number of patients, right? So we also need to think about scaling a physician, a nurse, an NP, whoever's treating the patient. And that can only happen with technology. We can't just throw more bodies at the problem.
Yeah. And when we talked, was it yesterday, you had said that was one of the big drivers personally for you after spending time at Google and really seeing that, they're addressing big problems, mm-hmm. but to find a way to make that more scalable, to be able to, take that out to the masses versus just one by one, treating these patients one by one. The scalability of that was kind of what drove you to think of something like this, right?
Absolutely. And so that's kind of what allows us to design sort of the product that we now have. It's how do we take the existing healthcare system and how do we just increase their capabilities, right? And so there's several pieces to what we've built. One is, first of all, let's understand the data that lives with healthcare systems today. They have these massive electronic health records with all sorts of information in there. No one has any insight as to what it actually holds. It's very messy. There's a lot of information, but it's not accessible for the physicians, for the nurses who are treating you, because there's too much there for them to consume and for them to really use in that 10-minute visit they have with you.
I hear that routinely from physicians that, they say that the data actually can be a bigger problem than good if there's not insights attached to it. They're like, don't give us any more data. The more data we get, it's just our heads are spinning. We need insights. What are the actionable? What does all this data mean? How can I enact that in a 10-minute patient visit or a 5-minute telehealth follow-up call versus just giving them raw data and saying, here you go, this is really valuable. You should figure out a way to use it, right?
Exactly. No, that's absolutely true. So, and that's the reason we kind of build into the EHRs, the electronic health records, and we say, okay, let's first find out what's currently going on with your patients and your population. Where are the gaps in their care? Who's on the right medications? Who maybe could use some improvement in what medications are on or what therapies they're getting or what tests they need next? Let's find those gaps and let's bring that to your attention but in a way that you can take action on it.
Yeah, that's interesting. So before we get into the platform even, can you identify what some of those, like where are the patients slipping through the cracks? Obviously medication is one, but what are some of the challenges that physicians are facing that you guys are setting out to address?
Yeah, that's a great question. And I think there's a lot of opportunities. So one is a lot of times we know that the patient would benefit from these medications or these therapies. And when you actually look at patients and what they're actually getting, they're not getting those medications, not getting those therapies. And there's a multitude of reasons why that problem exists, right? A lot of it's what I've said already. You just don't have insight into what's going on with the patient at home. You're only seeing them for 10 minutes during a visit. So you're really concerned as a doctor on what's going on right now with the patient. You kind of forget all this other stuff that's going on in the background that you really should be paying attention to, but you don't have the time.
Right. Or maybe access to that information.
Or even access to information. That's true. Like if you're a specialist, you may not know what's going on in the primary care doctor's office if they're living in a different system, right? So that's kind of one set of problems. The second set of problems is, if you're a patient, you go see your primary care doctor, and they're like, this is a really big problem. We actually need you to go see a specialist. Well, chance of that patient actually getting to a specialist in time, it's tough because there's a huge wait line to see the specialist. In a lot of
Yep.
areas, there's not even availability. A lot of specialists are not even taking new patients. You're going to have to travel, 100 miles in some cases, 200 miles to go see that specialist that you need. That means you have to take time off of work. You got to figure out how you're going to get there, et cetera. And so sometimes those specialist visits don't even happen. And when they do happen, by the time the patient gets there, sometimes it's too late, right? They're so far gone in their disease that if only they had been seen a month, 2 months, 6 months earlier, we could have done something, and now we can't. So, a lot of times it's also, are we identifying the patients? Are we seeing the patients at the right time to give them the right treatment? So it's really about finding the patients, giving the right treatment, the right test at the right time is kind of one of the focuses here.
Yeah, no, that's great. I guess last question before we get into the platform is how big is the market? Like how patient wise and dollar volume wise? I mean, is it $1 billion? What is it?
Yeah, well, so if you look at it, adjusted heart failure alone, that's what I say, 6 to 8 million patients.
Wow. And there's 320 million in the country?
That's right. So it's big as just heart failure, and it's one of the highest cost drivers. We're talking about billions of dollars just in that market. But really, this problem is not just in heart failure, right? It's in diabetes. It's in patients who have liver disease, patients who have lung disease. It's
Dialysis.
dialysis is a huge one, right? This whole company is formed around just solving this problem
Yeah.
for patients. And in each of those markets, it's billions and billions of dollars of opportunity. So it's a huge, huge problem. And it's one of these areas where if you fill in the gaps for these patients, obviously the patients win because they get better care, but the health system wins because getting reduced costs on their side. Payers win because they're getting reduced costs on their side. It's kind of one of these few situations in healthcare where everyone is on the same page and everyone wins.
Everyone's got the same end goal. Yeah. And, that really, I mean, that's a multi-pronged discussion in and of itself is when you think about, okay, so you're not only are you lowering readmissions, but part of the problem is by the time the patients get to the hospital, they're so sick that it's really tough to get that patient back to par, so to speak. Whereas if you're monitoring this patient on an ongoing basis, you're going to notice that there's a marked decline before they get to that point where it's irreversible, I would think. And then when and if they do have to go see a specialist or they do have to go back to their doctor, they do have to go to the hospital, the magnitude of care needed is probably a lot less than if they just wait till they're at home and they get so bad that they've got to go to the ER.
Yeah, no, that's true. I mean, I think that's where that continuous care model idea comes from.
Yeah, and we're seeing it in there's a couple other companies out there that are doing some neat things around pulmonary market with COPD is a big one. It's definitely the way of the future, and like you said, it's rare is the case where you can have the patient, the healthcare provider, the insurance company, and the hospital all with similar alignment. So it's kind of a perfect storm from that perspective. So yeah, let's jump into it. Tell us about the platform. Kind of, obviously we know the problem you're trying to solve, but how does this work in practicality, and what does it look like?
Yeah, like I said, we start in the electronic health record. Let's identify the patients who have gaps in their care. And our first product, as an example, was in heart failure. About 1% of patients in this country are actually on all the medications they're supposed to be on for heart failure at the right dose.
Wow.
Yeah, it's a really,
That's
really small.
shocking.
It shocked me when I knew it was a low number. When I first heard that number,
Right.
it shocked me. And so, how do we identify who these patients are, what their gaps are? Let's surface that to clinicians and make it actionable for them. Once we surface it to the clinicians, they can introduce our program, Story Health, to the patients, and we get them enrolled in our program. And now we have this program that's a mix of technology and services that really says, here's a patient where they are today, here's the goal where we want to get them, and let's bring them along for the journey in several ways. One is, now that we've identified where their gap is, we can say, okay, here's the algorithm of how to get them to goal with their medications. We get that approved by their physician, and we start interacting with the patient at home. We set them home devices to monitor their blood pressure, heart rate, all the things that are going to be affected by these medications.
Yep.
We make sure that they get laboratory labs drawn on time, so that we can see if these medications are affecting their kidneys, their potassium levels, all of those type of things. And we have health coaches help guide them through this process. A lot of this is technology based. We're interacting with them over automated texts. We have a whole platform of interaction that they can have using their cell phones. But what really makes this a success is our health coaches, which are the human side of this, that really enable the technology to work. And we really guide the patient and the physicians through the process of, here's how the medication is supposed to be on, how are you feeling, are you tolerating the medication, and bringing all that feedback and all that data to the physician in a way that they can digest and make decisions about the next step in medication therapy, and eventually getting them to goal. So that's kind of the idea with our first set of products.
Is it an app-based program or a web-based program? How does it work? I know, after doing some research, I know a lot of the SMS plays a big part in it, right? The text messaging, but is it app-based, web-based? How does that work?
Yeah, so we actually chose not to go the app route, largely because we found many of our patients, they're elderly or they've got multiple problems, they're not necessarily tech savvy.
That's a good call.
Yeah, you ask them to download an app, remember their Apple ID and password, it's just not going to happen, right?
Yep.
So we actually chose SMS as the primary form of communication. And SMS works really well for most patients because even our elderly patients who've never used technology, it's funny, most of them actually do text with their grandkids. So they know how to use text.
Yeah. Yeah, they're comfortable with the FaceTime, like you said, from the grandkids and the text messaging. It's very pervasive.
Exactly. So and texting, what that also allows us to do, it allows us to oftentimes bring that caregiver into the picture. So we not only include the patient on the platform, we their caregiver, whether it's their spouse, a daughter, son, whoever is kind of helping with their medical care and medications, they're kind of brought in as part of their care team and bring the communication loop.
So obviously this is tied into the EMR. And when those text messages go back and forth, is everything pushed to the physician, or does that go in the EMR and then he gets an alert through the EMR that says, hey, you need to go in and take a look at this? How is the physician alerted that, hey, there might be something going on here?
Yeah, so the nice thing is, because we're built to the EHR, we're also built into the physician workflows. So they don't have to log into a separate app themselves or go anywhere else to interact with Story Health. We're actually sending them messages into in basket or this message center, and that's where they're getting the messages from their nurses. That's where they're getting messages from patients, and so it's kind of all within their current workflows. And because we're built into the EHR, we have an app that lives within the EHR. It actually looks part of the patient's EHR chart, and so it's just another on the chart, and it shows all the data collected in one place. And you can also take action, for the physician can take action right there in the chart.
In the chart, huh?
In the chart to patients at home. All they do is say, we show them the data, say, hey, this patient's doing great. They're ready for their next step. Here's the recommendation for the next step based on where they currently are. The physician clicks OK, and then we start our communication loop back with the patient, letting them know what the next step of medications are, how to increase the dose, or what new medication to start. It's very simple for the physician to use.
So the physicians have those apps, I believe, on their phone, right? EMR, EHR apps on their phones. So it's not like they've got to go back to their desk, log into the computer. They can access all of that. So that's probably another reason why you chose not to go with an app-based system, because it would be redundant for the physician too. I mean, if everything's in the EHR, they can just access it on their phone on the fly or whatnot.
Exactly. They can look at the messages. They can put in orders right there on their phone. Or whenever they take care of their normal sort of messages, that's when they take care of this as well.
Huh. We're backtracking a little bit here, but what was the spark? What was the moment where you were like, this needs to be created? Was it like, did you have a patient that you had, obviously these stories usually build over time to
Yeah.
where you get to that critical moment, but was there a moment where you had a patient where you're like, I should have been more aware of what was going on outside of the setting of inside the office visit, and I need to build this?
Yeah. I wish I could say it was just one patient, but frankly, it's every patient.
Yeah.
I think there's so many times, so I practice in a relatively underserved area. There's a lot of social determinants of health issues in that particular population. And so it's hard for me to treat that population in general anyway. But there is numerous times where I'm seeing a patient, I told him to follow up. I haven't seen him in 6 months or a year. And I'm looking at them like, I wish I knew what was going on with you at home before I saw you here today.
Yeah.
We could have done something a little bit differently and it would have changed your care a little bit. So just having the insight at home would have been great. And oftentimes, again, when I have a 10-minute visit with the patient, they're not telling me everything that's going on at home. They're not remembering everything that's going on. I certainly can't ask all the questions I want to ask. I'm just focused on the problem that I'm addressing at that time. And something may have been relevant that I don't find out about until 6 months later, right?
Yeah.
It happens to me all the time. So I think it's just a culmination of seeing patients over and over again with these exact same problems. It was like, this is a problem that needs to be solved.
Are you actively practicing now?
I still do practice, yeah.
Do you? Good for you.
Not as often as I used to, but I'm still rounding the hospital, implanting pacemakers every once in a while. I think it's a lot of the work that I do clinically still, even if it's not as much as it used to be, it really informs the work we do at Story Health, right?
Yeah, it's free research.
Absolutely, absolutely. It's like, what are the problems and
paid research? Yeah.
what am I hearing from all my colleagues and everybody else? It really said, okay, these are the pain points. These are the problems we need to solve.
Yeah, no, that's neat. Staying close to the problem at hand is sometimes after you build a company and it starts having a lot of success, sometimes you get removed from that, right? They always say that the executives get removed from the field, and then you kind of lose touch with what really you should be targeting and trying to accomplish. So that's great.
I mean, I think, the other thing it helps is, one of the focuses that we have is we don't want to solve the entire disease that we're treating. In heart failure, as an example, we're not going to solve all heart failure. So it's really crucial to understand what is the center of the problem. What is the one thing that you can solve? And if you solve that, it's going to have ripple effects for the patient and for the health system for other parts of the disease, right? So heart failure, we're not solving all of heart failure. We really focused initially on guideline-directed medical therapy. Let's get them on these crucial medications because we know that's going to reduce hospitalizations. It's going to reduce mortality. It's going to reduce costs.
If you could just do that alone, that would be a huge win.
And I think by continuing to practice, it's easier to keep in touch with what are the central part of that problem that needs to be solved that can have these ripple effects.
Yep. No, absolutely. So who is the customer? I always like to ask this question. This is the commercial side of background in me coming out. Who's the customer? Who do you sell to? Who pays for it? And what's the commercial model? So are you guys targeting large healthcare systems? Are you just targeting hospitals? Do you guys target physician offices? How does that work? Or is it all kind of lumped together?
Yeah, I mean, I think the customer is pretty broad because it's a kind of one of these win-win situations we described earlier. Primarily, we target health systems. They have the EHR, they have the large data centers that we can kind of first identify which patients have these gaps and really help them improve care across their system. So that's kind of our major customer today. But I think we're kind of transitioning more and more towards some of the value-based care providers, whether it's a health system who has a value-based care program, some of these payers.
I would think Kaiser would be interested in this.
Absolutely. I mean, they're the ones who are getting the most benefit. If you're reducing hospitalizations, you're preventing progression of disease for patients.
Because they pay for their own care.
Exactly. They're really capturing a lot of the value. And the nice thing about heart failure is, unlike, let's say, high blood pressure, where you have high blood pressure, it's a problem, but you're really not going to see the downstream effects for another 10 years.
Right.
Heart failure, you make a change in their medications today, you're going to get that benefit in the next few months, right?
And if you don't, there could be massive implications. you
Exactly.
know, whether it's hospitalization, death, or whatnot. So ultimately selling to the hospital systems, to the hospitals, and then do you guys have to infiltrate those hospitals and really drive awareness that the platform's available through the physicians, or are the hospitals pretty good about like, rounding up the troops, so to speak, and saying, hey, this is what we're going to implement. We want you guys moving towards this, or is it a hybrid?
Yeah. Our primary entry point has a lot of times been the leadership on the clinical side. Anytime you go to the chief of cardiology or the head of heart failure or the chair of medicine, they right away they get the value. They understand it. They recognize the problem for what it is because they see the problem day in day out,
Right.
and they realize that this is something that can really be a solution for them. They're kind of there's no question for them. And I think the when you go to the hospital system, the administrator side, you talk to them and they see sort of the value and the economic value and the value for the health system. And they're like, oh, and the doctors like it and the patients like it. It becomes a very easy sale. So,
Yeah, no, that's great. That's great. Is there reimbursement in place? How does it work in terms of, was there a code that you guys are accessing previously, but working to get your own code? How does that work?
yeah, no, that's a good question. I think especially now with the current economic climate, this is something that we get asked all the time, right? Well, this sounds great, but
How do we pay for it?
how do you pay for it, right? Revenue is kind of king right now with the current market. And luckily, there are reimbursement codes. So about 3 years ago now, CMS did come out with reimbursement codes for remote patient monitoring, for example, which is a small portion of what we do, but it is reimbursable. And so we do enable those kind of codes for hospital systems. Because of the health coaches that we have, we also enable time-based codes, such as chronic care management, principal care management codes for hospital systems, which oftentimes they may not even be using it at all, or if they are, they're really not getting
Right.
the value of spending time with the patients and education and guiding them the way our health coaches can. So because we have that human piece, we really also enable some of those codes. So there's a lot of different codes that we can enable for the health system that they really don't have the capability to do themselves.
Yeah. It's one of those products too, where you're like, even if you didn't have reimbursement, it's still, the cost savings is so compelling that I think you probably would still have a pretty cogent argument as to why people should be, applying the technology. But if you've got codes, then it makes it that much more obvious. So I always think social proof is a leading indicator for me in terms of like assessing startups and what's going to work and what's not going to work. And when I saw that you guys brought Andrew Sauer on as an advisor a couple months ago, I was like, okay, that's definitely a feather in their cap, which congratulations on that, by the way. For those listening that don't know who Andrew Sauer is, he's not only a digital opinion leader, but he's a KOL. He's one of the biggest names in heart failure. And I think what's unique about him is he's built some really progressive platforms where he's been at Kansas and whatnot. He's definitely, he's on the cutting edge of not just treating patients, but managing patients. And he seems like he's always looking for a forward-looking way to do that. So obviously took notice of that when that happened. The other thing I always like to look at is who's using it. Who were the early adopters? Can you share a little bit about, without getting too much into private information, can you share some of the users that you've had early success with?
Yeah, absolutely. Andrew's been great, and I think one of the reasons we're able to get him, and now we have a lot of interest from some of the KOLs like him, is because we really went very slow in the beginning. We said we're going to design this good product, we're going to test it out, make sure it works, iterate on it, and not really go big until we know this works. And I think that approach has really worked well. So, our first anchor partner was Christiana Care. It's kind of the largest healthcare system in Delaware. Very sort of, it's a system that's been around for a while, but still growing, very innovative. They've got some very interesting strategic sort of goals in innovating on the digital side of healthcare, but really just how we approach healthcare altogether. So they're a great first partner. But we really built with them sort of this initial platform. And we actually just presented last week our first public clinical data for our heart failure program. And it was resounding success. So
Yeah.
we've kind of now are launching a lot of relationships. We have a relationship with Duke, who's a major research partner. And we are about to kick off a large multi-center randomized control study. Unfortunately, I wish I could say names. I can't say them yet, but there are a lot of institutions like Duke throughout the
Yep.
country sort of leaders in the space. And I think it's going to be great to show this validated in that manner. And we have, again, a lot of other hospitals we're working with. At this time, a lot of relationships we're just starting off and kind of growing with them. And we're not in a place that I can tell you who they are, but I think we've been kind of blessed with having the results we've had. And I think that's kind of led to this sort of huge influx of interest.
Yeah, I can only imagine that once you start bringing names like Duke into the fold, people start paying attention real quick. Can you share what in that study, what, because that's going to be huge for you guys. Can you share what it'll be randomized against?
Yeah, so we're actually going to patients who have heart failure and who are suboptimal in their medical medications, just like I was describing earlier. We're going to randomize them either to using the Story Health platform to get their medications to goal, or sort of the standard of care at whatever clinic or hospital that they're.
So however they're managing it today, which is just not not managing it.
Yeah, we have several endpoints that we're looking at there. So one is, can we get them on better medications, better than standard? And I think we've kind of answered that question already, but this would be kind of in a randomized fashion to prove it out. There's already a lot of data out there showing that just getting them on the right medications, about a 50% drop in mortality over a 2-year period, and about a 2/3 drop in hospitalizations in that population.
Wow.
And that's just in a 2-year period, not even extending out further. So there's real benefits here. But we're also going to look at some of those endpoints as well. So we're not only looking at can we get on medications, we're going to be looking at, are we actually reducing hospitalizations in this population? Are they actually having clinical benefit? And maybe the most important to the patient, are we improving their quality of life?
Right.
So that's kind of one of the main things that we're going to be tracking as well.
And that'll be on some sort of qualitative score that ultimately you'll be able to extract some type of quantitative data from it, that's where, as they say, the proof's in the pudding, huh?
Exactly.
We talked about this a little bit yesterday, and I know, some of these, secondary and tertiary unintended benefits are important to you: health disparity, health equity. Any of those, do you see this product driving benefits outside of just the direct, managing medications and making sure that these patients are getting the treatment that they deserve and need? What other, kind of tertiary and secondary benefits do you see coming as a result of it?
Yeah, absolutely. So, I think going back to what are the reasons that patients have these gaps in their care in the first place, so some of it is what I've spoken about already, but a lot of it is sort of what leads to the health disparities and inequities, right? So a lot of these social determinants of health issues, the access to problems, and sort of the patient education or literacy issues. How do we address these things? Because without addressing those issues, you're really not going to be able to close the gaps in care that we need to. And I think that the product does a great job in that. So, in our heart failure population today, as an example, about 40% of our patients that we serve are African American. And traditionally, this has been a population which has not been treated with the same level and on the same medications as the rest of the American population. On our platform, though, the data that we have initially actually shows they're actually being treated with just as much medication, and oftentimes actually more medication, higher doses than the rest of the population.
Yeah. So do some of these subset patients, do they respond to different medications or different dosage of medications than another population, right? Like you said, the African American community might need more of this drug and less of this drug. And if they're just being managed, across the board the same, they're obviously being undertreated, right?
That's right. That's absolutely true. So there's actually 2 whole medications we use in heart failure that if you look at the studies, they don't really benefit the wider heart failure population, but they have specific benefits within the African American population. And they're not medications that get used that often sometimes, right? So how do we make sure that the appropriate person, whether they're African American, whether they're elderly, whether they have kidney disease, whatever their issue is, how do we make sure they're getting the right medication for them?
So it's personalized medicine.
Absolutely.
No, that's great. And I think that's one thing that, I don't want to say physicians just overlook it. They just don't have the time to, they're with that patient 10 minutes in their office. They don't have the time to sit there and be like, okay, here's all the factors that come into play for this patient. Okay, here's my recommendation. That's not a reasonable ask. But when you're aggregating this data in a programmatic fashion, and then you've got the artificial intelligence to be able to programmatically create or customize a treatment path for that patient, you're obviously going to get better results.
Yeah, no, absolutely. I mean, every physician wants to do the right thing. It's just we have to give them the tools and the platform to enable them to do the right thing, right? They're overwhelmed too, right? They're asked to do a lot, and they don't always have the tools or the time to make that happen. And there's certain things, problems they can't solve. So other social determinant issues, access to care. How can a physician or a nurse make sure that a patient can come to their clinic? They can't, right? They can't control the fact that a patient has 2 or 3 jobs. They can't take time off of work to get to the clinic. But a platform like this, where we can meet patients where they are,
Right.
that's crucial. I mean, to me, the idea of meeting patients where they are is so big. One of the things that we do today, for example, is we not only provide the devices at home, interact with them at home over SMS and our health coaches, we'll actually bring services into the home, right? So you can't get to the lab, no problem. We'll bring a phlebotomist to the home to draw your blood at home or to your workplace, meet you at your workplace, right? So you don't have to take that time off.
Or go pick up medications. You can just have them delivered right to their house.
Absolutely. It's really about figuring out what is the barrier that's preventing this patient from succeeding, and how do we get over that barrier with them.
That's amazing. Yeah, no, I've had just this year, I've dealt with my parents are 80 and 82, and they're getting to that age where things start going wrong, and they've had some significant challenges this year. They live up in Bakersfield. I live down here in Los Angeles. My brother lives in Dallas. We don't have any other family up there, and so it's been a challenge to get my parents back and forth to. My dad's had some non-healing wound ulcers with peripheral vascular disease, so for a good portion of time he's been in a wheelchair trying to get that sorted out. My mom's 80 years old. She can't load him up into the car and take him to the appointment, and so it's not just for the underprivileged where they just maybe don't have the financial means to make life easy. The underclass, the middle class, and the elites all struggle with this. It really is. It's a global issue. So that's fantastic. I always like asking this question because I think we learn most from our failures. What was the biggest challenge that you guys had to overcome in developing the platform?
Yeah, that's a great question. Developing the platform, I think, was not too hard. I mean, obviously there's challenges there, but we're lucky enough to have some world-class engineers and product people, et cetera. But I think one of the challenges is, how do you design something that can be used by this slow-moving and somewhat archaic health system?
Right.
I mean, we talked about already, healthcare doesn't change easily. And so you can be as innovative as you want, but if you have to work with the existing healthcare system, you really have to adapt to them and create something that is innovative, but that works within the context of how they currently work. And you have to build that bridge for them to get from here to the innovative future that they're looking to get to. I mean, that's not always easy. I mean, I'll give you an example. We built this technology, this platform. We had everything ready to go. We're ready to enroll our first patients. And then we're like, oh, there's one piece of technology that we missed. We had to get a fax machine because we had to back and forth from the hospital. Right? So, this is kind of where we are with the health systems, right?
Right. Yeah, that's a great example. I take a couple medications every month, and it was like I would get these 3-month prescriptions, right? And so the mail order would send me my drugs every 3 months, and then at the end of 3 months, I wouldn't get it. I wouldn't get an alert. And then I'd realize, and then I'd run out of my medication, and I'd call them, and they'd be like, "Well, we need your doctor to send us a update to the more refills on the prescription." And then I'd call the office, and they're like, "We faxed that over 3 times." And I'm like, you guys are still faxing these things over? Like, there's got to be a better way of skinning the cat here. Yeah, that was a moment where I was like, okay, that system's ripe for disruption. That's for sure. That's funny. I know we're kind of coming short on time here, but 2 questions I wanted to ask is, one is, I did some research. It doesn't really seem you guys have any direct competition. Nobody that does all of this. You've got, and like I said before, I mean, you could just make a company out of just making sure the medications are, adhered to and that they're taking the right medications. But did I miss that? Is there anybody else that's doing exactly what you're doing? Or it seems like there's one company might be doing this and one company might be doing this component of it, but nobody's really pulled it together in a nice coherent system that's easy to use like you guys have.
Yeah, I think that's true. I think there's a lot of people who will identify patients with gaps in their care, and then that's all they do. They leave it up to the hospital system or the physician to figure out what to do next. And there's a lot of people who will say, okay, we'll take the gaps in care and we'll have some sort of care plan at home. We'll do some home health
Right.
nursing or something like that. But they're not really helping guide the physicians on what's going on with the patient. And so there's kind of pieces of that people are tackling, but not this whole spectrum end to end sort of solution. And that's kind of how we're thinking about it. I would say the closest competition we have, there are some companies that are trying to take a device approach to this. As an example,
Oh, really?
where their belief is we can have a patient plug them into a device algorithm, and the physician is not even involved, right? We just change their medications. I'm fairly certain that the technology that we have today, I mean, like I said, our engineers are Google engineers, they're all AI experts.
Yeah.
Unfortunately, I wish we had that kind of technology today, but AI is not going to solve the problem alone. You need that human sort of piece.
Yeah, and even if you could, I don't know that physicians are ready to make that leap yet, where they're like, I mean, you might even, like, let's say, just for the sake of argument, that somebody was able to create that. Physicians are going to be reticent to, like, I always say with physicians, it's they trust, but they verify. They'll trust you, but they're going to verify also. And I don't know that the market's quite ready for that, where physicians are just going to put this thing on autopilot and let a device, fly the plane, so to speak.
That's right. That's right. And then I think the other set of competitors we have are probably, people who are working outside the healthcare system, right? So they may be trying to change medications, but they're working through your insurance company or your employer-based healthcare plan. They're not working directly with the people providing your care. I think that's one of the things that differentiates us from them is because we're working directly with your physicians, your nurses, we can really dig in a lot deeper into the problem than most of these other companies.
It's an interesting approach coming from a physician. Your background is really, I mean, gives you perspective that somebody coming from the outside might not. Because that's, as we talked about yesterday, I think, the biggest challenge I see with technology being deployed in mass in our system is that people can come up with great solutions, but they don't understand the delivery networks. And if you don't understand the delivery networks, it really doesn't matter how good the solution is. And being a physician founder has probably given you a really unique perspective to be able to build a technology that not only works, but can be deployed easily and effectively.
That's absolutely true. I've been a decade now into health technology, and I see brilliant people who are entrepreneurs and engineers and trying to develop healthcare technology. They come with great ideas. When it comes time to that delivery part, they just don't understand how we treat patients on the ground.
100%. Last question. This is always the most fun one or most interesting usually. What's the future look like? You guys didn't title this Story Health Heart Failure. It's
right.
Story
Right.
Health for a reason. What other exciting disease states are you going to tackle? I know you guys talked about, mentioned diabetes earlier. What else is on the docket?
I think it's what are the other chronic diseases that we can bring sort of this continuous care model to kind of find the gaps in care and fill them. So, we started heart failure. Heart failure is very patient specific. We treat one patient at a time type of program. We actually just launched some population health programs around hypertension and dyslipidemia. Basically, how do we treat populations of people? We can, instead of focusing just on one individual and that personal medicine we were talking about earlier, in hypertension, high blood pressure, 80% of patients can actually be treated with the same three medications over and over again. And if they are not treated by those three, that means something else is going on, and we need to funnel that rest of the 20% into specialized clinics. So how do we make sure we capture that 80% and the ones that are the 20%, we then funnel them into specialized programs. So a population health approach. We're going to be expanding further into cardiovascular with programs around arrhythmia, atrial fibrillation specifically. Then, as you mentioned, getting outside of cardiology into cardiology adjacent programs. Almost every heart failure patient also has diabetes, also has chronic
Right.
kidney disease, has a metabolic syndrome almost, right? And so how do we address these sort of multi-disease states is going to kind of be a future focus as well.
That's interesting. Do you think that the platform will evolve to where this will be applicable for the physician practice to subscribe to it? Because a lot of these disease states, they're managed through the clinic, right? And, or the office or whatnot. So is that, will that be, will you guys adapt to that over time? Or do you think that the hospital will kind of remain the primary customer, so to speak?
Yeah. I mean, in some ways, the clinic is the primary customer right now. It's mostly clinics that are associated with larger health systems,
Right.
on the scale of what this is right now.
But for like a private practice physician or something like that,
I don't see any reason that a private practice physician couldn't implement this at a future point.
especially if it was a endocrinologist, I'm thinking, like a private practice endocrinologist that, works out of his office most of the time, this platform would, seemingly very much apply. So
Yeah, absolutely.
it looks like it smells like a dead winter there. You've got on your hands. Really excited for you guys and can't wait to watch you guys from afar. And, always excited to see technologies that, not only can make an impact today, but it looks like you guys have a huge runway for the future. So thanks again for coming on, Dr. Govil. I really appreciate it. And definitely we'll be rooting for you guys from the sidelines. And when when this thing gets a little bit bigger and you guys are involved in some other disease states, maybe we can get you back on the show to do an update. That'd be great. So that's it for today, folks. This is the Bleeding Edge of Digital Health. Again, that was Dr. Ashul Govil, Chief Medical Officer and co-founder of Story Health. Thanks for tuning in, and we'll catch you next time.